Doc Talk with Dr. Paul Conley is copyright 2021, Signer Foundation, and is solely responsible for the content.
Thanks for tuning in to another episode of Doc Talk. We are here at Plateau Medical Center, and tonight our guest is our CEO, Josh Wedge. Josh has come on tonight because we want to talk a little bit about the renovations that we're doing here at the hospital, and also we just want to talk a little bit about how things have changed with COVID-19. We want to talk a little bit about how where we were and where we are now and where we're headed. With COVID-19, unfortunately, a lot of people did not receive medical care that very well was warranted or needed because of concerns about going into the hospital, concerns about COVID in the community as well. So Josh is going to talk to us a little bit about how things have changed with COVID, how things have changed here at Plateau Medical Center, and also how we're keeping things safe and how we're open for business. So Josh, thanks for coming on the show tonight.
Thanks for having me, Dr. Conley.
So Josh, you're a local, you're a West Virginia guy, right?
I am born and raised in Ripley, up in Jackson County, so I've spent a vast majority of my life growing up in the Mountain State, graduated Ripley High School, went on to Marshall University, and then lived in the Charleston area, Kanawha Valley area for a number of years. Spent the last 4 years in Southeast Alabama, but had a chance to come home last March.
So when you talk about coming home, that's when you started here at the hospital, correct?
Correct. I had previously worked at a hospital down in Dothan, Alabama. That's part of the same company that Plateau is part of. This job opened up, and obviously it was an opportunity to not only work with an awesome group of folks up here at Plateau, but get a chance to get closer to family at the same time.
Well, I mean, definitely we're glad to have a West Virginian here in a West Virginia hospital. I think that's one of the things that we want to talk about is the fact that we're here in a small community here in Fayette County, but some of the things that we offer at this small community, and it's important. I think that people understand the importance of small community hospitals, and I think you've done a great job. You started here 15 months ago, right when COVID was hitting us. So, being a new CEO, I mean, you have had to really adapt and modify, kind of your thought process with everything. So, with COVID, when we first started, with this, I know we've had a lot of meetings about, how we're going to keep, people safe and things that we do. Maybe you can talk just a little bit about, some of the things that we've done, with, our negative airflow rooms, with the new renovation, talk about, how we can offer monoclonal antibodies and antivirals and just a lot of things, that we've been able, to accomplish in that very short period, here at the hospital.
Well, you're exactly right, Dr. Conley. The last 15 months has been a journey, to say the least, that we're a lot like every other healthcare facility in the country. We've relied on CDC guidance a lot the past 15 months, which is ever changing, it seems like. So even the measures that we put in place here at the hospital changed as needed. So, we started out with Governor Justice's executive order last March, if you remember correctly, that paused all true elective cases. That coincided with my start here at the hospital. You and your colleagues with our surgical committee were great resources in helping navigate and put a lot of the same policies that we still utilize in place to keep our patients and staff safe. Thankfully, especially in the past 3 months, we've seen positivity rates in the state, and particularly our area, have gone down. So we've been able to pull back somewhat some of those measures. We're still requiring masks in the hospital. We're still allowing somewhat limited visitation. We've opened it back up, and certainly we'll make accommodations in special scenarios, but we still screen all of our patients and visitors coming into the facility. So a lot of the things, I'll just out of an abundance of precaution, we still have in place, but we are extremely grateful that we're seeing a lot of these things subside in our community.
Yeah, and I think that's important. That we talk a little bit about that. There was a period, when we were deferring, what were considered true elective cases, but now that's not the case. So we are open back up. We're open for business, and I think people need to understand that that healthcare needs continue on despite a pandemic. We've seen fatalities with this pandemic that are not directly COVID related, meaning an individual may have chest pain and they've just avoided going to the hospital just because of concerns of COVID, and unfortunately may have a heart attack at home and pass away from a non-COVID related issue. People delaying getting their colon cancer screening, breast cancer screening, what have you. So I think it's important that people understand that you as a CEO are taking care of the staff and the community. I being a staff member here, we make sure that people that come into the facility are safe, and yes, in all the patient care areas where we are in contact with patients, we are wearing masks. Even if we've been vaccinated, at this point. And I think that's something else, Josh. I got my COVID vaccine here at Plateau Medical Center the middle of December when Pfizer first rolled out the vaccine, and I was very fortunate. I was able to get that vaccine that very first Monday. And I know you have been really big and instrumental in getting staff members vaccinated. There's basically any staff member in the hospital that's wanted a COVID vaccine has received that, and I know that's been something that people in the community have continued to follow what you've done here. I want to talk a little bit about with you with the hospital and everything and things that you're doing about some of the renovations that this hospital was all started even prior to COVID. Currently we're sitting in one of the operating rooms. This is the robotics room. I mean, this is something that I think that small town hospitals don't always have. Robotics. We have a robotic committee here, and so maybe if you can just talk a little bit about what you as the CEO and what the hospital is doing for the community. Because again, I think small community hospitals in the state of West Virginia, because the tertiary care centers just cannot take care of everyone in the state of West Virginia, and so we really need to make sure that we keep these small hospitals up and going, which I know is tough for you to juggle from day to day, but it's so important that you continue to keep this hospital running in good working order.
Well, you touched on the renovation project, Dr. Conley. It's something that we're extremely proud of, and our community should be proud of as well. Back in 2018, we broke ground on a large expansion project, and really throughout most of our patient care areas, just a much needed facelift. The capital that's been poured into this building has been over $17 million to date, and thankfully we've wrapped up about 95% of it. We're tying up loose ends at this point, doing some outside curb appeal things, but we're proud of a lot of things, but we've expanded our OR, we've doubled the suites that you guys can operate in. We had operated out of an external GI suite for a number of years that we had the opportunity to remove off the campus, and you guys are operating in 2 new state-of-the-art facilities here. So we're certainly proud of that, and then just again, much needed facelift. You're exactly right. The community hospital like ours is critical. West Virginia, you're a lifelong West Virginian. You might be 15 miles on the map from a certain location, but due to our country roads, it might take you 20 minutes to get there. So removing community hospitals like ours out of the dynamic can really create a burden for the community members and create a long trip to receive care. So the renovation project makes our facility viable for many years to come, but like we discussed earlier, very proud of the renovation, but even prouder of our medical staff, our staff. It's the folks that work here is what makes Plateau special.
One of the things about small community hospitals, and again, people need to think about, coming into the emergency room if they need emergency care. And, I know that, again, with COVID, we've seen some of the folks, avoid coming to the hospital. And so no matter where you live, if you have a small community hospital, utilize that hospital because, you may have something that could be, life-threatening. And I know with the renovation, I know you talked about the 2 new endoscopy suites, and you talked about the 4 ORs and all the renovation. And yes, we used a mobile unit for quite some time. But, the emergency room is kind of the front door to any hospital,
Yes.
any small community hospital, because that's if you're out in the field and you have chest pain, you need to get to your closest hospital to receive care, whether it be stabilization from a car wreck, heart attack, stroke. And I know, here in the emergency room, Dr. Clint Curtis is our ER director. I know he really, really tries to keep a high standard, with our ER. And maybe we can talk a little bit about that, because the emergency room is another part of this renovation that's going on here at the hospital.
Well, glad you brought that up. That is actually part of the renovation. We just completed that phase probably 4 to 6 weeks ago. So part of that included expansion of our waiting area, but more importantly, some reconfiguration of the ED space in the whole. We have 8 rooms that we utilize. And you touched on a point a few minutes ago that was, it's excellent. The concern last year, especially as COVID spiked in our state, you're exactly right. Other conditions did not stop. So what we experienced here at this hospital is the same that every hospital in the state and really the country experienced as well. Our overall ED volumes throughout 2020 were down about 30 to 40%, which is terrifying. I mean, COVID was prevalent. You're exactly right, but there was a concern there that, I could be better off not seeking care even though I critically need it. We have great relationships with our EMS partners here in the county. They indicated throughout the year that their calls into 911 were down tremendously. Thankfully, and not thankfully that we're seeing utilization of our ER due to illness, but thankfully what we're seeing now within the past 2 months is a return of that volume. Our EMS arrivals are up, even versus pre-COVID levels. Our ED volumes are still down about 10% versus pre-COVID levels, but what that signifies most importantly is a return of confidence in healthcare. And certainly you've mentioned the measures that we've put in place here at the hospital, just general precautions, even going above and beyond to keep our staff and patients safe. I think that really reflects as a whole in the nation the return of confidence that if you need to seek care, it's safe to do so in a hospital.
Well, Josh, we're getting ready to come up on a break, but when we come back, I'm going to have you talk a little bit about some of the new things that I know are going on here at Plateau, with cardiology, with stroke, telemedicine. These are all things that have occurred, even with COVID, to be able to do telestroke. And so these are all things that are new and upcoming. So when we come back, I'm going to return with Josh Wedge, our CEO, and we're going to continue this talk with our new renovations here at Plateau Medical Center. So stay tuned. Welcome back to Doc Talk. This evening we're here with Josh Wedge, our CEO of Plateau Medical Center. So, we've been talking a little bit, Josh, about the renovations and again how important it is that small community hospitals continue to, change with the times with renovations, innovations, technology. And I think, again, small community hospital here in West Virginia, that's, what we're doing here. But, not always can a small community hospital take care of every single need, and that's why, there's that relationship between a small community hospital as well as a tertiary care center. And I know one of the things here, at Plateau Medical Center, and many small hospitals throughout the state have done, is you have an affiliation with a tertiary care center. So I know here at Plateau we have an affiliation with tertiary care centers. So stroke, telestroke, telemedicine, cardiology. Maybe you can tell us a little bit about how still, if you think you are having symptoms of a heart attack or stroke, it's still important to come to that small community hospital to be assessed, stabilized, worked up, and then potentially sent to a bigger center.
So you're exactly right. I know in one of your earlier episodes you touched on our affiliation agreement that was signed in Q1 of 2020 with Charleston Area Medical Center. That gives us access to resources that otherwise, if we were, I guess, on our own, we may not have. And we've really started to really take advantage of that, especially coming out of COVID. We have implemented, as of April 30th, telestroke, which allows us to directly connect to the providers, the neurology group at CAMC that, unfortunately, if a patient presents in our ED with stroke-like symptoms, we can directly tap into that group and quickly diagnose and treat and stabilize and transport to CAMC if needed those stroke-type symptoms. We've built on our cardiology services as well. We implemented telecardiology last year and have taken that a step further actually on June 1st, a couple of days ago, and expanded our actual on-site cardiology coverage with a provider from CAMC's cardiology group. That will allow us to expand our stress test services, some of our outpatient cardiology service. But you're exactly right. A facility our size, while expansion of services that we offer is a very good thing for our community, there are going to be certain things that are outside of our scope. So what those telehealth services allow us to do is, like you said, be that entry point to address the immediacy of any emergent conditions the patients might be experiencing. So whether it's stroke or cardiology or things of that nature, a lot of the smaller hospitals around the country will have similar type services. So you don't have to, if you're having a heart attack or a stroke, you don't have to drive an hour in your private vehicle to a large hospital to get immediate care. Facilities like ours can provide that first step immediately.
Right, and we don't want people, traveling an hour, hour and a half in a personal vehicle to receive care. So again, the importance, of the small community hospital. Again, here in West Virginia, country roads, take me home. But again, weather conditions, winter conditions.
Yep.
One thing, I think, with the pandemic is you talk about telehealth and telemedicine. I do think, we have learned how we can do, telehealth, telestroke, telemedicine, where in real time, because when we think about stroke, we think about heart attack, we always think about time. Time is of the essence. Time is myocardium. Time is brain. So if an individual comes in, to our facility, that individual can be worked up in a very timely manner. The CAT scan can be read instantaneously of the brain. If the patient's a candidate for TPA or lytic therapy, they can receive that here on the spot. Or if it's a patient who comes in with chest pain and the cardiologist can see the EKG, can see the lab work, and do actually a televisit, that patient may be someone that we can keep here at the hospital and be ruled out that this seems to be atypical chest pain, and then they can, be afforded the opportunity for our cardiology services to receive a stress test here in the hospital. Stress test is normal. They can be safely discharged home. So I think, those are all, things that, you're doing and we're doing here at the hospital to, again, warrant the safety of our community, and that folks here within the community, can come to our emergency room. The new renovations, quicker throughput times, again, with telemedicine and with these, innovations, with technology, we're able to actually get a neurologist right there on the screen. But, also, too, we are a small community hospital, but, we also have, clinics, throughout with Plateau Health. And, it's important, that folks in the community can receive that primary care, for their colon cancer screening, breast cancer screening, many, vaccinations, just your blood pressure, diabetes, all these different things, so important. And again, in rural West Virginia, It's so important that, you know, someone's be able to have a provider. And with Plateau Health is more than just the hospital itself. It incorporates, you know, these clinics that actually are, you know, part of, you know, this institution. So maybe you can talk a little bit about, you know, where we are with that and where we're looking to go forward.
Sure. Very proud of our Plateau Medical Group. It's a multi-specialty group that is spread through Raleigh County. We have a primary care office in Beckley, a general surgery office in Beckley as well. Your clinic right down the street here in Oak Hill, GI, very, very busy clinic. We have primary care presence here in Oak Hill as well, and then ENT and general surgery up in Fayetteville, and certainly always looking for opportunities to expand. You know, we have as a whole, our clinic system is very busy. It is growing by leaps and bounds. And just to even further expound on the telehealth portion of it, you know, I know your clinic were early adopters of this last year, as well as really all of our offices, as patients really became concerned with actually going into a healthcare type setting. Kudos to our community. They were great adopters of telehealth as well. And I know all of our providers actually really bought in and really matured that program very quickly last year, and it continues on through today. That whether it's due to concern or patient convenience or whatnot, you guys have the capability to see that patient in certain circumstances. Obviously, surgical consults, things of that nature, you'll need to see people in person, but for a lot of our appointments that you all complete, you all can complete them directly with the patient in the comfort of their own living room. And you know, that was probably COVID, if anything else, pushed us probably quicker along than what we may have progressed, but it's here to stay, and that's certainly another service we're proud to offer.
Well, I think, you know, one of the things that's important for people to understand is that we do have options.
Yes.
And, you know, people have options, you know, within, you know, organization. And, you know, not all small hospitals have, you know, a sleep lab, you know, just down the street, you know, for obstructive sleep apnea. You know, we have sleep clinic here. You know, we've been in our ENT office in which, you know, you can receive, you know, ultrasounds there in the office, different, you know, procedures within the clinics, general surgery. You know, we have, you know, again, cardiology services. We have dental services, dental surgery. We have podiatry. There's, you know, and orthopedics as well. So, you know, I think, you know, the small hospital is something that I think, you know, people in the community should feel that they don't have to travel, you know, to a city, you know. So I think, you know, one of the things about, you know, small town hospital is that, you know, you get, you know, with the telemedicine, you get big city medicine, big city care with that hometown touch, you know. And I think that's one of the things about, you know, working in a small community hospital is that we're part of the community. You know, we live here, we go to church here, we go to the grocery store here. I mean, you know, we go to the ball field here. And so I think, you know, it's one of the things that I want, you know, people to understand that, you know, hey, we are open for business. We want to take care of you. We want to, you know, to see you if you need us. If you need us, you know, we're there. And I think, you know, Josh, you know, with a lot of the renovations that you have continued to implement and continue to expand the services here, you know, I know as a physician, you know, I'm very, you know, proud of what we've done. You know, we went through a pandemic that's never been seen before. No one's seen the likes of this pandemic. You know, things I know, you know, we don't have much time on the broadcast, but, you know, all the negative airflow rooms, all the planning, you know, the things that, you know, we've done with changing, you know, the different suites and how we have, you know, done with, you know, the monoclonal antibodies and remdesivir and the treatments and everything that, you know, we've had to, you know, go through. But just like you said, I mean, people that have, you know, other healthcare needs, you know, I want to make sure that they understand that, you know, you can come here to this small community hospital and receive, you know, state-of-the-art care.
That's right. You know, I would put our quality up against anybody else's in the country. You know, we have low infection rates. Our patients think the world of us. Per our patient surveys that we get on a continuous basis, we continually score in the 90th percentile in overall satisfaction. But again, it's on the backs of people like you, Dr. Conley, the rest of our medical staff, and the staff throughout the organization. I mean, they are all local people, and without that, it's good. We're proud of the facilities and the renovations and the end product of all these things. I think it's something the community would be proud of as well. But again, it's the people that work here that make it that way, and it's like that throughout the state as well. I know a lot of organizations can boast that as well, but we're excited. I mean, we're excited for the opportunity to continue to care for our community for many years to come. We're proud of the impact that we have. We recently completed our community report. In 2020 alone, in a quote-unquote down year, we contributed $2.4 million to the community in capital projects. We contributed $1.3 million in property sales tax contributions to our community. We're a for-profit hospital, so we're happy to pay that. And over $17 million in payroll for our staff here, all local folks that are putting that money right back into the community. So again, it's humbling to serve a community like ours here in southern West Virginia, but again, it's a wonderful facility, but it's the people that run it.
But again, I mean, we've got West Virginians here taking care of West Virginians, and I think that's so important. So for those of you watching the broadcast, I've been here with Josh Wedge, our CEO. Thanks for coming. I'm Dr. Paul Conley, and until next time, have a good night.
Doc Talk with Dr. Paul Conley is copyright 2021, Signer Foundation, and is solely responsible for the content.